Thanks for taking the time to watch this video. We've put this video together because you are going to undergo, or you've already undergone, what's called tarsal tunnel surgery. Okay, it's similar to carpal tunnel surgery, except it's in the foot and the ankle. And the purpose of this surgery is to decompress the nerves in your foot and in your ankle in order to improve the pain that you might be having, or the numbness, or some combination thereof in your foot and your ankle. It's a nerve related problem, and it's due to compression of the nerve. And so we're going to decompress the nerves there in the foot and the ankle. Now, you have likely received a whole bunch of information from the recovery room nurses going over what to expect after surgery, what you should and should not do. And I wanted to put this video together to make it easier for you to be able to follow those instructions. A lot of people find it confusing after surgery. They're kind of groggy from some of the medicines. They've gotten a lot of information. They're not sure what to do with it. They don't know whether or not they remember everything. And so I found that a lot of patients really appreciate getting this kind of information in this format. For some of you, it's easier for you to watch a video or hear somebody talk to you about what to expect after surgery. And that's the reason we put this video together. You'll also notice that amongst all the different papers that you got after surgery is a piece of paper that looks like this, okay? And this paper, it might be this fluorescent yellow, it might be fluorescent green, it might be fluorescent orange, or fluorescent pink. It's the only fluorescent piece of paper in all the pieces of paper you got. This piece of paper has on it all the discharge instructions from my office that I want you to know, okay? So the vast majority of the questions that you're going to have should be answered by this piece of paper, okay? Take a close look at it. If you want to, share it with your family members. If you have an email address, we've already emailed this to you as well, so you can share it with your family so that they can help you navigate this and help you through your recovery process, okay? In addition to that, we've also emailed you, and you'll also find a hard copy in your paperwork of something that looks like this, okay? This is the same information, except it's in the form of a graph, okay? And the reason we put it together this way is that some people find it easier to read their instructions in this format, and other people find it easier to look at their instructions in this format. Okay, now you've got three different ways to get your instructions. You've got the graph, you've got it written out, and of course we're going to go over all that same information in this video. So take the time to watch the whole thing. I think you'll find that the vast majority of the questions that you have, most likely all of the questions you have, will be answered in this video. If you still have questions after having gone through the video and gone through those other written instructions, then certainly feel free to give us a call here at the office. Our number is found on the discharge instructions, and you can also find it on our website, and you'll also find our email address on the website, which is info@draguila.com, okay? And you'll also see that here at the bottom of the screen. That's our email address. Feel free to send us emails if you have questions that aren't urgent. And then, of course, you'll also notice at the bottom of the fluorescent discharge instruction sheet is my cell phone number. Okay, all of my post-operative patients get my cell phone number. So if you've got questions or concerns that weren't answered by all this other stuff, please text me or call me. It's not just there for decoration. I'm happy to address whatever questions or concerns that you might have. Okay. Now, in addition to those pieces of paper, there's one other piece of paper that you got in your discharge instructions amongst that probably stack of paper this thick that I do want you to pay particular attention to, and it's this piece of paper right here, okay? And you'll see it up on the screen here in a second. This piece of paper goes over what kind of Tylenol you should be using, as well as what kind of Tylenol you should not be using after surgery. We're going to go over that in a little more detail here in a minute, but I wanted to make you aware that you should have that piece of paper handy so that you're ready to take a look and see exactly which kind of Tylenol you're going to need after surgery, okay? In addition to that, you're going to see a picture here of a big bandage, okay? You're going to be wearing a big bulky bandage after this surgery. It might come up just above the ankle, or it might come all the way up toward the knee. And this bandage is intended to help you after surgery. It stays in place for 1 week after surgery, okay? So don't remove it. You shouldn't need to change it. If it does need to be changed, we will change that for you here in our office, okay? If you have concerns or questions about it, again, give us a call. This bandage has to be kept clean and dry. That's very important, okay? And so when you get in the shower, which it's okay to do, unless I've told you otherwise, when you get in the shower, please make sure you do what you can to protect this bandage from getting wet, and don't let it get dirty. Okay, now some people will use what's called a cast bag for that. You can pick those up at the drugstore. Some people will take a big garbage bag and use some duct tape and tape it around their knee. Put the foot in the bag and then tape the bag up around the knee in order to make it waterproof. That's fine too. I have had patients in the past who have taken the big bulky bandage and just stuck it outside the shower curtain and then showered the rest of themselves. And if that's an effective way for you to keep your bandage clean and dry, well then great, feel free to do that as well. The main thing is we want to keep that bandage clean and dry. That's very important. It stays on for a week. We'll change it for you when you come back to the office. When you come back to the office, we will switch that over to an ACE bandage, which you'll wear at least for the first week after surgery and possibly longer than that, okay? And again, you'll see this in your discharge instructions. Now, on top of that big bulky bandage, you're going to notice you're going to have what's called a surgical shoe, okay? It is not a surgical boot. This is a surgical shoe, okay? It might look like this one right here, okay, which is kind of flat. You can see there, and it's got these straps here, okay, here and here. And it's also got these flaps here that help hold your foot in the bandage, okay? That's one variety that we sometimes use. The other one is one that looks like this, okay? And you'll notice there are elastic bands on here, like right here and right here, right here, and they're adjustable using this right here, okay? You'll notice that your foot will slide in here, and it's got treads on the bottom. These are not boots, okay? This is very important. You are not wearing a surgical boot, okay? The purpose of a surgical boot is to immobilize your foot, to keep it from moving after surgery, and that's exactly what we don't want to do, okay? The purpose of this shoe is to allow you to be able to walk with the bandage on and not wear through the bottom of the bandage, okay? It also gives you a little bit of traction so that if it's winter time and you're concerned about things being slippery, well then this is a little less slippery, okay? Because you got those treads there. But it gets back to our original point. It is important for you to walk on this foot after surgery. The reason that it's important to do so is twofold. Number one, we want you to decrease the likelihood of developing what's called a deep venous thrombosis, called a DVT, or a venous thromboembolus, which is called a VTE. Okay, both of those are the same. They're the same thing. It's a blood clot in one of the deep veins in your leg, and that's problematic and that's concerning because if you develop that, it can break off and go to your lungs and cause all kinds of really, really serious problems. And so it's important for you to get up and walk around after surgery in order to prevent that from happening. So walking around is really important. Don't let anybody tell you otherwise, unless I told you after surgery that you should not walk around. But that's a rare exception. And you'll see on your discharge instructions if that's the case, okay, on the written discharge instructions. But for the most part, it's important to get up and walk around. Obviously, we don't want you doing any running or anything like that, but the walking around is important. Okay, the other reason that we want you to get up and walk around is that the purpose of doing this surgery is to decompress the nerves in your foot and in your ankle. And in doing so, we're making more room for those nerves to work. And the other thing that we're doing is we're allowing them to be able to move around because they've probably been stuck in a particular spot and the compression has been preventing them from working properly. After surgery, the movement of you walking allows that nerve to glide back and forth in the operative bed. And if you're not walking like that and you're not moving your foot back and forth like that, then what ends up happening is that very early on, scar tissue will start to stick down onto that nerve and prevent the nerve from being able to glide easily. And we found, and Dr. Dellin discovered, that if you get the nerves to slide back and forth early on after surgery, the likelihood of needing more surgery for that later on down the road is significantly lower. Okay, the success rate is much higher if you can get that nerve gliding very early after surgery, and so that's really important. So getting up and walking around is very important. Now, there are a couple exceptions to that. Number one, if we told you not to walk around, then obviously don't walk around. Number two, if you find that your foot and your ankle are really, really numb at the end of the procedure, then I don't want you walking around on it until that numbness goes away. Okay, and the reason for that is that we inject a lot of a local anesthetic, a long-acting local anesthetic called Exparel around the nerve. Okay, this does what we call a long-acting nerve block, and what that's meant to do is numb up the nerve for a number of hours, and in some cases a few days, in order to help with your post-operative pain. Okay, now for most people, all it does is it helps with their pain, but there is a small percentage of people who find that it works so well that they've got numbness and tingling and weakness of that foot and ankle for a few days. Now, if that's the case, I don't want you walking on it, because if you can't feel your foot and your ankle, then there's a possibility that you might twist your ankle without realizing it, and then you'll end up in the emergency room for a separate problem, and we want to avoid that. Okay, so that's one of the reasons we use the Exparel in the post-operative nerve block. But the other reason that we do it is that there are some studies which have shown that a long-acting numbing agent, a local anesthetic like that, used after nerve surgery can decrease the risk of developing what's called complex regional pain syndrome. Okay, CRPS for short. Complex regional pain syndrome is a nerve-related problem in which you end up with chronic nerve-related pain, even though there might not be anything else going on with that extremity. Sometimes it happens after surgery on one of your limbs. It can happen after injuries. It can happen for no apparent reason at all. Okay, but we want to try to prevent that, and that's the reason for using the Exparel in the nerve block at the end of the procedure. Okay, but as I mentioned, when we use that, sometimes you may end up with numbness or tingling or weakness, and if that's the case, I don't want you walking on it until the numbness and tingling and weakness goes away. Then it's really important for you to get up and move about. Okay, now when you are moving about, it's important for you to do some walking, at least a quarter of a mile a day, I would say, whether that's in the house, going back and forth between the kitchen and the bathroom and wherever else, or whether you're walking down to the mailbox and back, or whatever it is that you feel like doing. It is important, however, when you are not walking around, to keep your foot and your ankle elevated. Okay, you should keep it at least as high as your hip, if not higher than that. And there are a few reasons for that as well. Number one, it helps with swelling. Number two, it helps with pain. Number three, it helps with any oozing that you might have. Okay, so some of you may end up with some oozing from the wound, and some of that may make its way to the surface of the bandage. You might see a little bit of blood on the surface of your bandage, and that's okay. Okay, that's nothing to be worried about. On the other hand, if you're leaving tracks all over the house, then you should probably give us a call so that we can see what's going on and potentially change that bandage for you. Okay, but in many cases, most patients won't have any of that oozing, and if you happen to be one of those few patients that does, then keeping your foot elevated will help with that. Okay, but that doesn't mean you keep your foot elevated and don't walk. Okay, it's important to walk. Just make sure when you're not walking, you keep your foot and your ankle elevated at least as high as your hip, if not higher. So let's go over activity restrictions. You'll hear different people talk about, oh, you should use hydrogen peroxide, you should use alcohol on your wound in order to prevent an infection. I would advise against that, particularly with this surgery. We don't want you using alcohol on the incision. We don't want you using hydrogen peroxide on the incision, and don't use Neosporin or anything else on the incision that we didn't explicitly tell you about. Okay? If you have questions or concerns about that, send me a text message or give me a call. You'll notice that on the bottom of this discharge instruction sheet is my cell phone number. Okay? All of my post-operative patients get my cell phone number, And so just give us a call if you have a concern. Send me a text message, give me a call. If what you've read and what you've seen and what you're hearing me say now doesn't make sense, that's available for you as a resource as well. Okay, so you can get the incision wet in the shower, but please don't go swimming and don't take a bath until you've been cleared by me or Steve to do so. Okay. Other activity restrictions. For the first 2 weeks after surgery, it is important that you not lift anything heavier than a gallon of milk. Okay? For the first 2 weeks after surgery, don't lift anything heavier than a gallon of milk. The reason for that is that we don't want the wound popping open, and we also don't want you causing a bunch of bleeding that could occur if you overdo it. Okay? So for the first 2 weeks, don't lift anything heavier than a gallon of milk. The third week after surgery, you can lift up to 20 pounds, and the fourth week after surgery, you can lift up to 40 pounds. After 4 weeks, assuming you haven't had any wound healing problems, there are no longer any activity restrictions. Okay, but please try to stick with those activity restrictions in order for you to get the best results. Okay, so that you have fewer problems and decrease the risk of complications, and so that you get a great result. Because obviously we're going through the trouble of undergoing surgery. We want you to get the best results possible. Okay, a couple other things. You'll notice that you have recommendations for a number of different medicines to help you with pain after surgery. Okay, and those medicines have a particular way of being taken, and there are particular reasons for you taking them. Okay, so I want to go over each of those right now. As far as pain control after surgery, it is important to take Tylenol extended release. Sometimes it's called Tylenol arthritis or Tylenol 8-hour. You will also have received this in your email, and you'll also have received it as a hard copy. Okay, so you'll notice on here there's a picture of which version of Tylenol you should get and which versions of Tylenol you should not get. It's important to keep that in mind because I want you to take this Tylenol every 8 hours. And if you take the wrong version, you do run the risk of an overdose. So make sure you have the right version, the extended release 8-hour Tylenol. You're going to take that 1,300 milligrams, which is 2 pills, okay, every 8 hours, whether you have pain or not. And that's important to do for the first 4 weeks after surgery. Okay, whether you have pain or not, unless you hear from me or Steve otherwise, take the Tylenol every 8 hours around the clock in order to help control the pain. In addition to that, I want you to take some ibuprofen. That'll be 800 milligrams every 8 hours. Now, of course, some of you are thinking to yourselves right now, okay, well, that means I have to take the ibuprofen at noon, I got to take the Tylenol at 4, and then the ibuprofen at 8. The reason we chose the 8-hour Tylenol is to make it easier for you to keep track of your medicines. Tylenol and ibuprofen do not work the same way, and so it's okay to take both of them together. And we purposely chose this in order to make it easier for you to keep track of it. So let's say, for instance, you're going to take your Tylenol at 8 a.m., then take your ibuprofen at 8 a.m. also, okay? And then obviously 8 hours later, you would take both of them together. And so that would be, let's say, at 4 p.m., you'll take both of them together. So take both of them together. That'll help you to be able to sleep through the night without having to wake up in the middle of the night to take the medicine for pain. Both of these medicines, it's important to take around the clock for the first 4 weeks after surgery, whether you have pain or not, okay? One of the reasons for that is that if you keep the pain under good control, then the likelihood that you'll need the oxycodone, which we're going to talk about in a minute, is significantly lower. Okay, it's a lot easier to stay ahead of the pain than it is to try to catch up on it. That's number one. Number two, there are some studies which have suggested that in patients who undergo surgery, if you have better pain control early on, the likelihood of having chronic nerve-related pain a year later is significantly lower. And so we're trying to avoid that also. So it's not just to make you comfortable now. We're trying to get you a better result later on down the road. So it's important to take the ibuprofen and the Tylenol as it's directed on your discharge instruction sheet and as we're talking about right now. Okay. The third medicine that I want you to know about is oxycodone. Okay, oxycodone is a narcotic pain medicine. You can take that up to every 4 hours. You can take up to 10 milligrams every 4 hours. All right, this you only take as needed. If you don't have pain, then don't take it. If you got a lot of pain, then take it. But don't take it any more often than every 4 hours unless you hear from me or Steve otherwise, okay? This is as needed. And of the different medicines we're going to talk about right now, this is the only medicine that you take as needed. All the other ones you take on a schedule regardless of whether or not you have pain, okay? So that's the oxycodone. And this is the one that most people are concerned about because they're concerned about the risk of addiction. This is the medicine that we want to try to minimize the use of if we can. But if you're having pain, it is important to take it because controlling that pain early on has, again, been shown to decrease the likelihood of chronic nerve-related pain a year or two later on down the road, okay? So let's talk about gabapentin. That's the next medicine that you're going to take, okay? Now, some of you will have been taking gabapentin before surgery already, and some of you will have been taking Lyrica before surgery already. If you were taking Lyrica, then ignore what we're going to say about the gabapentin. If you were taking gabapentin before surgery already, then these instructions might apply to you depending on the dose that you were taking. If you were taking a relatively low dose, we're going to increase that dose. We're going to talk about that in a second. If you were already taking a high dose, then you're going to stay on that. You'll notice the details for that in your written discharge instructions, so pay particular attention to that, please. Okay? Now, for those of you that have never been on gabapentin, or maybe you were on it in the past and now you're being asked to take it again, you should have taken a dose of gabapentin, a big dose, the night before surgery. It is important to take the gabapentin every 8 hours for the first 2 weeks after surgery, okay? The ibuprofen you're going to take every 8 hours for 4 weeks after surgery, whether you have pain or not, okay? The Tylenol you're going to take every 8 hours for 4 weeks after surgery, whether you have pain or not. The gabapentin you're going to take every 8 hours for 2 weeks after surgery, whether you have pain or not. Again, the reason for this is to decrease the risk of chronic nerve-related pain later on down the road, in addition to helping you with your immediate pain after surgery, okay? So the gabapentin you're going to take for 2 weeks after surgery. The ibuprofen and the Tylenol you're going to take for 4 weeks after surgery. All three of those, regardless of whether or not you have pain, okay? The next medicine is a little bit unusual, or at least it may seem a little bit unusual at first, and it's high-dose vitamin C, 1,500 milligrams that you're going to take, okay, every day for the first month, for 4 weeks after surgery, okay? The vitamin C isn't a nutritional supplement in this case. This isn't because we have some concern about whether or not you're getting enough vitamin C or whether or not you have some kind of nutritional deficiency. The reason for the vitamin C is that in some studies it's been shown that using high-dose vitamin C after certain types of nerve-related procedures, it can decrease the risk of what's called complex regional pain syndrome, which is a nerve-related pain problem, which is chronic pain that typically won't show up immediately after surgery. There have been some studies which have suggested that taking the high-dose vitamin C will help with chronic nerve-related pain a year after surgery, okay? It'll prevent you from having chronic nerve-related pain a year later. Okay, so it is important to take it now. You're not going to notice a difference now in terms of how it makes you feel. It will make a difference later on down the road, and so that's the reason for taking that. Okay, the only other medicine that's on the list, I know it seems like it's been a long laundry list of medicine. The other medicine that's on the list that's important for you to take is minocycline. Okay, now for those of you that are allergic to tetracycline or allergic to minocycline, you'll have a prescription for Bactrim instead. But either way, that's an antibiotic that you take twice a day, every 12 hours, and you'll notice again on your discharge instructions it'll say exactly which medicine and for how long. Okay, so you're going to take that every 12 hours for 10 days. Please take it until it's all gone. We should never hear about leftover antibiotics. Leftover and antibiotics don't go in the same sentence together, okay? So take those until they're gone. That's in order to decrease the risk of a wound infection. If you end up with a wound infection, there is a higher risk of having chronic nerve-related pain later on down the road, not to mention having a more prominent scar. So please keep that in mind. Try to avoid the risk of wound infection. Take the antibiotics until they're gone. Okay. The last thing I want to mention has to do with ice and heat. Okay. Now you may have gotten lots of differing advice from different people about ice and heat. Okay. when it comes to this particular surgery, please pay attention to what I'm about to mention to you now, okay? It's going to be different, most likely, than what you've heard from other doctors and from your physical therapist and anybody else as it pertains to ice and heat. And I'm going to go over why we choose to do things a little bit differently, okay? So for the first 48 hours after surgery, you can use ice, okay? And a lot of people find that it's helpful in terms of managing discomfort. So use the ice. Don't use it for more than 20 minutes every hour, okay? But you can use it every hour, but not more than 20 minutes every hour. If you do it more often than that, you do run the risk of developing frostbite, okay? And so pay particular attention to that. 20 minutes at the most every hour, okay? That's for the first 48 hours. After 48 hours, do not apply ice any longer, okay? You can use heat, again, for up to 20 minutes every hour. And the reason for that is that the ice is helpful initially after surgery because it decreases swelling by decreasing blood flow to that area, okay? And it also helps with pain for some patients because it numbs up the nerves, kind of like just before frostbite. And that's the reason we don't want to overdo it, because you don't want to end up with frostbite. But the reason we switch to heat after 48 hours, which might be contrary to some of the things you've heard from other people, is that the heat causes the blood vessels to open up, okay, what we call vasodilation. And when the blood vessels open up, it increases blood flow to that area. It increases oxygenation. It increases the amount of nutrients that get to that area. And as a plastic surgeon, one of my highest priorities is making sure that that wound heals as well as possible and as quickly as possible. And the heat and the nutrition and the oxygenation and the improved blood flow ensure that that wound is going to heal as well as possible, okay? By using ice, what you're doing is you're decreasing blood flow to the area. You're slowing down the healing process, okay? Now, I'm not telling you to not follow your other doctor's directions if you've gotten instructions about some other kind of surgery and what they're telling you as far as ice goes, okay? Whatever your other doctor told you about your other surgery, follow those instructions. But when it comes to a surgery that I have done for you, please follow these instructions. Ice for 48 hours, again, no more than 20 minutes every hour. And then after the first 48 hours, switch to heat. Do not apply ice any longer after the first 48 hours, okay? Lastly, if you have any concerns or questions that were not covered in this video or that weren't covered in the written discharge instructions, or there's something that you're confused about, you don't understand, that's a good opportunity for you to call our office or email us at info@draguila.com or to send me a text message or call me. Again, you have my cell phone number. Every single one of my post-operative patients gets my cell phone number, so this is the time when you want to text or call if everything we've just gone over is still confusing or doesn't answer a question that you have, okay? So don't be shy. Let me know if you have any other concerns or questions. And most importantly, please be careful and take care. We look forward to seeing you soon.